Hi guys, today I'm going to talk about the industrial action that is due to be happening with the junior doctors in about a month from today. So if you don't know already, I am a junior doctor. I work in England, although I'm currently not working because maybe I'm part of the problem, I don't know. But the state of the NHS at the moment is horrendous. I do not want to step foot in a hospital, but it looks like I might have to in the near future, but that is a story for another day. That's a story in many of my other videos if you want to go check them out. But we recently balloted for potential industrial action, and that is what I wanted to talk to you about. I wanted to talk about my stance, and that will be at the end, but I want to also talk about the GMC, which is our regulatory body. This is hopefully going to be a quick video, okay? But it never turns out that way. The regulatory body, the GMC, the BMA, which their stance is pretty obvious, consultants, so they are not junior doctors, and patients. And then, like I said, I'll talk about my take at the end. So the number of voters was amazing. It was 77, nearly 0.5%, which is, you need to get 50% of eligible voters in order to have basically a strike. Now, what is even more interesting is the number of yes votes. Now, the number of yes votes was amazing. It was, why haven't I got it written down? It was something like 98%. It was phenomenal. 98% yes. I think it was 1.98% no. There were a few invalid or spoilt papers. There are only 21 of those. So I'm like, what happened to those? Like, I really want to know. Do people just mark both, or what did they do? I'm just thinking I don't know. I really can't fathom. In my head, I'm like, did somebody wipe their bum with it or something and then put it in the post? I hope not. Now, the GMC stance is very interesting. Let me get up an article. It's called Our Position on Industrial Action. Very straight to the point. It's extremely on the fence. Basically, it says, yes, doctors are legally entitled to take part in industrial action, lawful industrial action. However, this I think is a little bit questionably I don't know. The guidance, they then highlight the guidance that we should be reminded of, which is good medical practice. And it's basically saying, just remember to keep patients safe and stay... Oh, okay, I didn't read that sentence, but I read it as keep patients safe. So as in if you want to keep patients safe, guys, you shouldn't go and strike. But then it says staying within the limits of their competence. But as in, if you're really understaffed and you're not striking, then you shouldn't be expected, if you don't know how to do a certain procedure, you shouldn't go and do it because you're really understaffed. You should get somebody who's appropriate to do it. Now I've read that properly, I feel a bit less begrudged by it, but fine. So does pay actually make working in the NHS or as a doctor any better? I would say technically no. It's not going to make your working conditions significantly better, but it is amazing to me that we have faced a nearly 30% pay cut over the last 10 to 15 years. Since 2008, it's about 30%. I think it's 27 or something. But the difference is, why have we received a pay cut? It just doesn't make any sense. There's no budget funding for insane hospital treatments that we give, but it's okay to stagnate our pay even though inflation's going up. Now, I don't think that's okay, even though I'm not technically a junior doctor being employed under the pay that normal junior doctors get paid in. I am a locum, but it definitely affects me wanting to go into training because I'm I just don't think the pay is equates to the amount of time and effort you put in. And it's not just time at work, you spend a lot of time outside of work. You don't just leave. You have, if you're a trainee, you do portfolio stuff and everything. So look, I could talk about this for hours, but I'm trying to keep it brief. I think we've put up with a lot, okay? We are not allowed our annual leave obviously I'm not talking about me, I'm talking about other junior doctors. They're not allowed their annual leave when they request it, even if it is 6 weeks in advance. They're not given their rotas, they can't plan their lives. They're moved all the way across the region. And we sacrifice a lot. And yes, we went into this profession, but we also went into it with the kind of, at the time we went into it, the pay was actually, yes, not at 2008 levels, but it was better. And people don't go into it for pay, but you kind of, it's not like we're asking for 100% pay rise. We're just asking for our pay to be back at where it was and where it should be. That is literally not a pay rise. Like, it's just what, and if you look, I need to finish my sentences. It's just what we were at in 2008. Now, if you look at what the actual increase is, yes, it's going to be a lot cumulatively across the whole of the country, but it's literally like £3 an hour or something. It's really not that much. It's not as though we're asking to get paid like £100 an hour. It's very minute, I would say. I know to some people that's a lot, but compared to what we could be asking for, given that, I've got 60, 70 grand of debt, etc. Okay, look, I'm sure you've heard all these arguments before, so I don't need to go into it, but we've put up with a lot. Our kindness has been used against us for a long time. Now, there was another strike in 2016, and I wasn't part of that because I was a medical student, basically. So we were told, like, just keep away, just stay out of it, don't get involved. You're not a doctor, so stay out the way. Let them all sort it out. So I don't know really what happened. I know they arranged some kind of pay deal where you went up by 2% or something, pay rise every year. Now that was definitely not, when inflation's been 10%, it's, another 8% pay cut. So it's not really matching up. Anyway, consultants' views. I'm trying to get through this fairly quickly. Consultants' views. Now, last time we striked, and in the lead up to balloting for this strike, consultants' opinions, now maybe some of them that weren't in agreement with it kept their mouths shut, but the ones that I spoke to that told me their opinion were all very positive. They lived through an era where pay was at 2008 levels, and then everything started getting cut. So they've seen it. They've seen the decline. They've seen the they had a bad time with working hours and things in the past, and yes, it was still hard then, but at least they got rewarded for it. Okay. And a lot of them recognise that. Now, I'm not speaking for them. That is just what they've said to me. I'm just relaying that information. So I think a lot of the consultants, although they will have to bear the brunt of this strike, which is 72 hours long, it is March 14th, 15th and 16th. So if you can stay out of hospital at that time, that would be pretty great. But, for the patients, but I haven't been in hospital for a long time, so I don't know the current consensus within the hospital. I mean, obviously the junior doctors want to strike, but I think everyone's just fed up. We went through Corona, COVID, pandemic. We felt like literal fodder. We weren't giving PPE. We feel, and it's not as though we're like, we demand respect, but it's like, I think we just feel undervalued, and we're like, why are we putting up with this? Like, our government is a joke. We put up with their crap all the time, and we basically went through a war. Some people have got PTSD from seeing people their mum's age or their age die. And if somebody goes to war, a soldier, Do they get rewarded for it? Yes, of course they do. Like, it's not a question. I mean, that's another argument, okay? But they get money to go on tours and things because it's a financial incentive. Otherwise, you wouldn't do it. But we didn't have a choice. I say it's a war, okay? Because we were in a war against COVID, and it was scary. We were fearing for our own lives, let alone other people's. We didn't know what was going to happen. It was a scary time. So to not call it a war, I think, is an understatement. But anyway, we went through that, and it's just been a real shitstorm since then, to be honest. So I think everyone just feels a bit disheartened. Everyone feels undervalued, not necessarily by completely the public, but definitely by some of the public. Especially there's a lot of demands coming from patients. It's fair enough, but we bear the brunt of that. I understand that people are annoyed at waiting and things, but that's not our fault, or doctors' faults or nurses' faults. That is the government's fault. I'm sorry to scapegoat, but they need to sort themselves out. Okay, so now we're on patient views, I suppose. I think patients will obviously be worried. Now, if you haven't seen my video on the strike, which I'll leave in the cards maybe, or at the end, those people that I spoke to, they were worried. They were concerned because they were of an age that they could definitely go into hospital at any moment. And I think people will be worried for that day. Now, I think less people, they'll obviously cancel elective stuff and it'll only be emergencies. I have to think, we're on the topic of people dying here. It's not a nice topic, but I think it's an important one to cover. I might get in trouble for saying that. Okay, will there be increased risk to patients on that day? Now, the aim is that obviously, hopefully not, but we can't really say either way. I think it's a possibility. But is it a possibility if there were... I still think it's a possibility anyway, because imagine you have still junior doctors in the hospital, but there's understaffing and there's only one doctor on a ward. Now, the consultant's like, well, it's fine, it's sorted, there's a junior doctor there. But the point is that it's not, because one doctor looking after 30 patients is definitely not okay. It's too many, but it happens. So there's an argument that maybe one consultant looking after 30 patients might actually be better, but that's that's not how hospitals work. But and it will be more work for them. Unfortunately, I just think it's a place that we've been driven to, and I think people are unsafe every day. I think it's a potentially silly argument to say, well, people might die on that day, when people are dying every day because the NHS is underfunded and can't get an ambulance out, and they're lying on the floor, and there's the risk is not comparable, I would say. But that is my opinion. Anyway, my take. Will I be going to the picket? Yes, I think I will. Will I be going to the picket to film? I think so, yeah. I am not going to strike as such because I wouldn't be working anyway, so technically I can't strike. But that doesn't mean I can't go there, and I'll probably take my camera and film some of it and cover some of the situation, or, maybe talk to some people. There'll probably be some other news crews there anyway, so... I'll definitely be attending. It's a momentous moment. Well, momentous as in I might never see it again. I imagine we won't get what we want first time. The government will blame a lot of the potential deaths or patient issues or hospital issues on us. I don't think that's fair when unfortunately the issues are just trickling down from up above, which is them. I can't see that we'll get 30% pay rise. I like to be positive and think that. I think it will take a lot of work to move our government, and I think they have some kind of psychopathic ability not to care about people. So I think who will care about people more? Us. And they will just be like, well, it's your problem, not ours. They're your patients. So I think it'll be a battle of chicken, essentially, unfortunately. Now, that is the end. I'd like to make an important announcement, however. I think in the coming weeks, number one, I'm going to have to go back to work because of money, mainly just related to me not working over the last 2 months, and also a hefty £9,000 HMRC, thanks government, tax rebate. So I will have to be going back to work now. What I'm a bit concerned about is how I'm going to daily video, so daily upload. So I think instead I'm going to be potentially, I haven't fully got it in my head yet, but dropping down to 5 days a week, so uploading Monday to Friday and then having the weekends off. But I'll probably be filming, but I'll upload them on Monday. Anyway, let me know what you think of the strikes down below. I know it's a controversial subject. I may have said some controversial things. I don't think that anybody's opinion is wrong. I think it's a very interesting debate and it's a very interesting topic. But I think if it's hard to see it from the outside, and I think if people are upset by the strikes or the opinion of the fact that I think it's a good thing to strike, I mean, although 98% of doctors who voted also agreed with me, so it's not an unfounded opinion, then guys, I would think, where is that coming from? Are you scared for yourself? Are you scared for family members? I just think over the last couple of years, especially, how many chronic diseases and non-emergency things have been put by the wayside because the NHS is underfunded, and cancer diagnoses have gone undiagnosed. People have died as a result or got severely worse, or I don't think we can just penalise the short-term issue when you need to look at the bigger picture and look at the long-term issue and how that realistically affects the emergencies, the elective stuff, and the chronic illnesses as well. So anyway, if you liked it, give it a like, I suppose. Let me know what you think in the comments down below, and I will see you tomorrow. Bye.